Question number 3, the Honourable Ruth Dyson.
Thank you, Mr Speaker. My question is to the Minister of Health. Does he still stand by his policy to deliver better, sooner and more convenient health care?
The Honourable Tony Ryall.
Despite the fact that the previous government quietly cut $150 million from Vote Health and left DHBs delivering $160 million of unfunded health services, yes.
The Honourable Ruth Dyson.
On what date did he first receive a draft copy of the Hon report, and what changes did he require the independent ministerial group to make to that draft?
The Honourable Tony Ryall.
Mr Speaker, I did not receive a draft copy of the independent report, nor did I instruct that any recommendations be changed.
The Honourable Ruth Dyson.
Will he now release all material associated with the independent review of the health sector and allow a transparent and sooner rather than later submissions process?
The Honourable Tony Ryall.
Mr Speaker, this is an independent report that is being carefully considered, and I can assure the member that the government will not be agreeing to anything that increases bureaucracy or doesn't improve frontline services.
Dr Paul Hutchison.
Thank you, Mr Speaker. To the Minister of Health, with respect to better health care for young women, what is his response to reports from an American government study released today which apparently raises questions about the safety of the cervical cancer vaccine Gardasil?
The Honourable Tony Ryall.
Mr Speaker, the safety of the Gardasil vaccine is being continuously monitored in New Zealand by Medsafe and the Independent Centre for the Independent Centre of Adverse Medical Reactions. Up to the 14th of August, 162,000 doses of Gardasil were given in New Zealand, and there were 166 reported adverse events. That's 0.1%. Of these adverse events, only one is classified as serious, and I'm advised that it's considered unlikely that this event was caused by the vaccine. Mr Speaker, authorities are clear. Based on our experience in New Zealand, they consider the benefits of Gardasil in the prevention of cervical cancer clearly outweigh the possible risks of side effects, and they consider it safe for New Zealand girls and women. New Zealand authorities continue to monitor international evidence and our experience here at home.
Kevin Hague.
Thank you, Mr Speaker. Supplementary to the Minister. Does he now agree that his government made a tragic mistake in slashing funding for programs for healthy eating designed to reduce long-term health needs without any evidence that they weren't working?
The Honourable Tony Ryall.
Mr Speaker, the government has not slashed the budget for healthy eating projects. What the government has done is sought more balance in the approach between physical activity and nutrition.
Dr Paul Hutchison.
Thank you, Mr Speaker. To the Minister of Health, what responses has he seen in relation to the public release of the ministerial group report?
Honourable Tony Ryall.
Mr Speaker, there have been a number of informed responses. The New Zealand doctor says that primary care gives the thumbs up to the report. The New Zealand Herald has said that the government must move fast on health reform, and the Timaru Herald says that the report looks like a good start. The Health and Disability Commissioner, Ron Patterson, says that all the recommendations in this report need to be considered. He's backing the key recommendation on quality. He says, quote, "We need to do this. There is a strong case for it, but we need to do it in a more effective way than we are doing currently under the Quality Improvement Committee, with different DHBs taking a lead."
Kevin Hague.
Thank you, Mr Speaker. Supplementary to the Minister. Given that diet is the biggest single influence on lifetime health status, what are his programs to reduce diet-related illness in the long run, given the Ministerial Review Group's projections for future unaffordable health need?
The Honourable Tony Ryall.
Mr Speaker, the programs that were in place under the previous government are continuing in that area, and this government has also announced a number of initiatives, or a particular initiative around sport for young New Zealanders, which will be contributing to physical activity.
The Honourable Ruth Dyson.
What discussions did he or any of his staff have with the chair of the Health Select Committee, who today voted against the Select Committee hearing submissions from the public about the Horn report?
The Honourable Tony Ryall.
Mr Speaker, I have very regular discussions with the chair of the Health Select Committee, and I must say that in our last discussion we talked about the rather poor state of the member opposite's questions in the House.
Order. 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 The House will come to order. I thought the Minister asked a fairly clear question there and didn't deserve the last part of that answer. Had the Minister sat down a little earlier, I might have been less concerned, but I'll invite the Minister to repeat her question so all the House can hear it and the Minister can answer it again. Honourable Ruth Dyson.
What discussions did he or any of his staff have with the chair of the Health Select Committee, who today voted against the Select Committee hearing submissions from the public about the Horn report?
Honourable Tony Ryall.
Mr Speaker, I have regular conversations with the chair of the Health Select Committee, and today's decision, I'm sure, was a decision of the committee.